Okay, hello and greetings to everyone, of all of our listeners and audience. Today I have a very special guest with me, a guest that I basically don't need to even introduce because all of you know him. I have a Professor Dr. Stuart McGill with me today, directly from Canada, Ontario, Gravenhurst, right? You're at your home. Yeah, it's a nice winter morning there and a nice winter afternoon here in Slovenia. So let's start first, Stuart. For those very few people that still don't know of you, maybe you could do a short intro, short bio of your life, a few sentences.
I'm an extraordinary cook, fisherman, and lover.
Well, that's it.
There's a Twitter format summary. You know, I couldn't resist. You set me up with that one. I'm a retired professor. I was a professor at University of Waterloo for 30 years, and we started out with the question, simply, how does the spine work? And over the 30 years, all sorts of questions evolved, and we investigated them from basic science questions of how the spine works and supports loads. How does it break down and become painful? What are the best ways to rehabilitate pained people? How do you enhance performance in an athlete? How do you restore the competitive function and foundation in an athlete? All of these back-related questions. So that's and of course it got us together as you became the representative in Slovenia and did a fabulous translation of the book Back Mechanic into Slovenian. So it's been a process that has been so joyful in uniting so many people around the world.
And of course, you're also known by your legendary, I have them here also, legendary mustache.
I did shave that off once. And
I've seen these pictures. Yeah, it's a totally different person.
Yeah, I got so much flack from people around the world, and they said, that's not
true, yeah.
So I had to grow it back. My wife hates it, but...
Your wife hates it? Okay.
Oh, yeah. Yeah, we refer to it as wife repellent.
Oh, yeah. Probably true. Yeah. Well, okay. So, you're also getting more and more known in other disciplines as well. You know, I've been reading a very good book recently by Nassim Taleb, Anti-Fragile, and you were mentioned in this book as one of the go-to guys for sound research, which is not so common anymore in science about back pain. Maybe you know the book.
I know the book. I know all this quite well, as you. But the theme of the book was to prepare your life to withstand unpredictable events. And he used our approach to back pain as a medical example of creating anti-fragility in people's backs specifically, but in their body. Yeah.
Yeah, that's true. And also recently I've heard of your name on a Joe Rogan podcast. So I hope you'll be invited there as well. I think Pavel Tsetsulin mentioned you in an interview with Joe Rogan.
Well, I think I've been on several times. At least my name has been mentioned several times. But
I'm cheering now. that you'll be there. I've sent some emails to him to his website. But I hope you'll read it. Anyway,
he's a very interesting fellow.
He is.
And we certainly have many common friends, although I've never met him.
Yeah. Well, okay. So let's start now with a first question. Question also posted to me by my clients, by our listeners. So many people know you by the big three exercises, which are presented in this book, Back Mechanic. that people can order online on your webpage or Amazon or on my webpage. But I think that many people think that exercises are vital part of this book, and also they think that they have to invest the most time of learning the exercises. That's the vital thing that is gonna get them out of the pain. But can you tell us, which steps are actually those that should be prior to the exercise regime? Which are those steps that people usually don't invest so much time into as opposed to exercises, but they should?
Well, that's a very perceptive question. Of course, people want, and I get this on emails every day, can you give us some exercises for my back? And my response is, no, I can't, because the first order of business is to stop the cause. Well, in order to discuss, well, let me take one step back. And if they say back pain, I'll say, well, if you had leg pain, what exercises would you do? Well, leg pain from a medical perspective really doesn't exist. They might have a burned leg, torn ligaments in their knee, a broken femur, an infection, or whatever. In other words, leg pain needs to be broken down and subcategorized into specific groups so that the treatment is appropriate and targeting that specific mechanism. Well, back pain is exactly the same. So we can't even begin a discussion on back pain. How it begins is there has to be some form of assessment. And depending on the clinical skills or of the person themselves, that's what back mechanic does. It guides them through a simplified series of tests so they can begin to understand what is the category of their specific pain triggers. Well, once they become savvy to that, they might see that a specific movement or a specific posture or a specific activity is leading them to stay sensitized in pain. So, but prior to give exercise, we give them lessons in what we call spine hygiene, which are hacks, movement strategies to perform the activities of daily life that, unbeknownst to them prior to the assessment, were keeping them sensitized. They didn't have chronic back pain. They had mini acute insults to their pain triggers all day long that kept them sensitized. So we educate them on appropriate movement hacks or spine hygiene techniques, and the pain sensitivity winds down. And it's very similar to someone who stubbed their toe. Their toe gets a bit sore, and then they stub it again, and it hurts even more. And then the cat walks over their toe, and they scream. Well, the key was stop stubbing your toe. The pain sensitivity will wind down. I'm not going to give you exercises to desensitize your toe, but then we will build your body once again to restore its resilience in a strategic way, depending on how old you are and what your specific mechanism history is, what your goals in life are, and all that kind of thing. So to summarize the answer, it is recognize the cause and utilize spine hygiene to wind down the pain sensitivity.
Sure. Okay, so next question, stability training. So today, many people are convinced that, back pain necessarily means not enough stability in core or torso. And stability training, as I've noticed, is very much overhyped also in gym trainings, and etc. At what point would you say, too much stability training can become an issue, can become part of a problem?
Well, I would say that about any kind of training. There's always an optimum, not too much and not too little. Well, where does that tipping point lie for the individual in front of us? And you see, you could take two people, and the answer would be very different. So we use the term sufficient stability. You need a little bit of stability for several reasons, and I've written quite extensively of why stability And it, from a mechanical point of view, that means stiffness. It's really a non-negotiable determinant, because we live in a mechanical linkage. Our skeleton is a mechanical linkage. So if I wanted to wiggle my finger very quickly, I had to stiffen my wrist. In other words, through a linkage, for me to create athletic function, I had to create proximal stiffness. So if I pushed you and I didn't have proximal stability, my spine would just bend. In other words, I just pushed myself away. So I needed proximal stability and control to create that distal athleticism. However, there's a price that you pay. In other words, to create proximal stiffness, I had to co-contract those muscles. Now, if I co-contract them too much, the compressive cost to activating those muscles forms a penalty function. And then if I keep adding more stiffness and stability, the penalty function also grows. So do you see, it's a trade-off all the time, and that's why we talk about sufficient stability. And you are correct in your question. There are some people who are over-stiffened, over-stabilized, and the penalty function of crush into their spine now becomes part of their pain picture. So it's a matter that, what's the cure of all of this? It's a matter of skilled clinicians and trainers to know what is sufficient stability, just enough to meet the goal, no more. And but you know, there's no question. You have to have it, but it's got to be appropriately tuned. In other words, there's a context. What's the context for that person in front of us? Is it a stay-at-home mom who wants to lift their child out of the crib at 3 o'clock in the morning for feeding?
Yeah.
Well,
yeah,
or is it someone who wants to set a powerlifting record, or sprint, or play basketball with their children, or whatever? Needs a context.
I think the hardest thing for a trainer to do sometimes is, because everyone has his own weak spot. Every profession has his weak spot. Let's say every profession has its own hammer, and trainers usually use, only, strength, exercise, more exercise. And the hardest thing for them, often I see, is to tell some of their clients who are too much training, too much stiff, too much, into tension, to take it easy sometimes, and to not go so many times on a training, or to do some exercises more easily. Would you say, that sometimes for this type of people who are too much, in tension all the time, could be to just tell them to do some things and exercises in a more efficient manner, not to use so much stability, to kind of adjust the stability for the task.
Oh, absolutely. Absolutely. Take a person who comes in, excuse me, with muscular backache, and they come into your gym or your clinic and they're standing with their chin protruded forward like this. Mm-hmm. In other words, not ideal posture. And you palpate their erector spinae muscles and they're rock hard. But they tell you, I've got muscular backache. So is the cure to do more exercise? No, it's, can you stand and get your ears over your shoulders, over your hips, and over your ankles? Now stand with zero muscle. Can you stand perfectly relaxed with zero muscle? And now, can you walk with minimal effort? Can you turn your body into an elastic band where you store and recover elastic energy? You swing your arms in anti-phase with your leg strides and do it just on elastics, as gently as in minimal effort as possible. So that might be a training tool that is very just unleashing of a person who's so tense. It might be for a variety of reasons. It might be an inappropriate motor control strategy that some coach gave them who wasn't very competent, or it might have been a postural situation that has just added to the point where the muscles never relax. So anyway, there's a tool for a situation.
Sure. Okay, next question is about the menace of flexion. Everyone is talking about this flexion, when to use it, how to use it, when to train the flexion. So the question is as follows. When the flexion mechanism is one of the causes for pain, for example, like picking up things from the floor, should we treat it by adding more so-called controlled flexion? And if not, when can we start adding flexion back into our client's life?
Well, it's a great question to which there's no singular answer for every client. If there was, trainers and coaches and physical therapists would be replaced by a computer algorithm, but it doesn't exist. So the answer is it depends. It depends on the person's age, their training goals. What do they need flexion for? Well, if it's to simply put their socks on in the morning with no stress and no pain triggers, all right. That's a very different goal from someone who says, I want to train to increase my deadlift, or I want to compete at strongman. Anyway, so it gets back to this idea of context. But there are some scientific rules, shall we say, rules of biology that govern this relationship somewhat. If a person has a very flexible spine, generally speaking, they've made a trade-off in that they will not tolerate high compressive loads, because what you need to bear high compressive loads is adapted stiffness. So when you look at a power lifter, there's an example of someone who must create an ability to bear very, very high compression. The spine is a flexible rod, so it will buckle. No engineer would take a flexible rod and squeeze it. It just collapses. So you have to add supreme stiffness if you want to lift a very impressive load. But in the process of you see, the spinal joints are not ball and socket joints. Ball and socket joints are made for mobility, to flex, extend, bend, twist. That's what they're made to do. But the spinal joints are discs. They're collagen fibers. They are an adaptable fabric. So with my jersey here, if I moved the fibers in my shirt back and forth over and over and over again, they would slowly delaminate and work apart. So the collagen fibers of the spine, if you get a lot of mobility, which is wonderful, it just means you won't set the world's record in deadlifting or squatting, because you had to adapt stiffness in the ground substance in those discs. Otherwise, the nucleus pressure, the gel inside the disc, it's an enclosed hydraulic, incompressible fluid in a hydraulic cylinder. If you weaken the walls by adding more mobility and less viscous and gooiness, if you will, of the ground substance, the nucleus will slowly work through the delaminations in the collagen. So if you want to be a gymnast, fabulous. Work with your body weight. Work on parallel bars, but don't deadlift. So do you see how it's a discussion that really needs a discussion? So let me put a real life example into this, because I know your question. I'm asked it all the time. And I come from the perspective of having restored some careers of jiu-jitsu athletes. And I'm just not talking about, a fellow who trains after work. I'm talking about some of the top guys in the world and in fight leagues like the UFC and whatnot. So they have trained sit-ups and lots of spine mobility, and they're very good jiu-jitsu masters, and they roll on the mats, and their bodies really become snake-like. They're boa constrictors. That's what jiu-jitsu is. But they come to me because they can't train anymore. They've got so much back pain. And they'll say, can you help me restore my career? And, I guess they've heard that we've done it a few times. And I'll say, well, we have to I've just measured your pain mechanisms. It is flexion or a certain twist or whatever it happens to be. But since we're talking about flexion, we'll stay there. And I said, show me about your training regimens. Well, they'll do 100 sit-ups, and then they press their hands, palms flat to their floor. And I'll say, well, there's your pain. And they say, well, yes, I have to do flexion to do jujitsu in the cage or on the mat or whatever it is. We need that to compete. And I said, but you can't even train. You're in so much pain. So what we're going to do now is take that mechanism out of your training and allow you to desensitize. So you're not going to do all the mobility training. You're going to stop the sit-ups, and we're going to replace that now, the flexion movements, with flexion moment. Now do stir the pot. So they're on their toes, they're swirling their elbows around on a big gym ball, and they might do that for sometimes minutes, building tremendous flexion athleticism in an isometric way that doesn't trigger pain. Slowly their pain winds down, and guess what? Now they're back training jujitsu. So it was a matter of winding down the pain by avoiding the pain mechanism, and then they come back and say, you know what? My strikes are harder. When I strike an opponent, because I've gained more proximal stiffness, you get more power transmission across the shoulder to the distal limb. So they turn the hips, they've got more stiffness through the core, and then they fire a jab or a hook or whatever it happens to be. Now we measure it. They're actually striking harder by avoiding flexion movements and replacing it with flexion moments. So I can give example after example.
Yeah.
But
so basically you saved the flexion coins by avoiding, flexion training and sparing them and, letting them to do this flexion in competition, not in training.
Exactly. Right? That was going to be my final point. So you save the coins, so to speak, that you've built up in training for competition. Now, competition is 100%. They're in there fighting for their lives. So you do what you need to do to have a good outcome in the competition. And that's what athletes do. They build competitive capacity by the way that they train. And then they might be a bit sore after the competition, but then it's time to detune their athleticism, restore their body, and then they start the next cycle for the next competition. But anyway, there it is. And
What about, for example, just an ordinary middle-aged father, let's say, who has a pain only when he bends down for tying his shoes, and then he reads your book, Back Mechanic, and he sees that he can do this tying of his shoes. He can do this task by lunging on a stool, on a chair, and he successfully winds down his pain in his back in a few weeks. He's happy, and then he wants more. He asks me or his coach, okay, I wound down my pain, but should I now use this lunge for tying my shoes forever, or can I now try to bend like I did in the old painy days?
It's a great question, but the answer is it depends. I usually say to the patient, well, what's your goal? What do you want to do? If you want to risk returning to where you previously were before you saw me, go ahead.
Just tying the shoes. Okay.
Yeah, go back and tie your shoes the old way. However, if you want to play basketball with your grandchildren, if you want to go out and split firewood for your fireplace, if you want to have longer time sitting at the computer without pain, what I would suggest you do is you put some money in the bank. You save your coins with spine hygiene, and then it allows you to do more things in life where you will need to have some flexion ability. But
or more training,
or you can spend them tying your shoe. I know what I would choose. And you see, our grandfathers didn't sit in front of the computers for the hours that we do. I mean, look at us right now. We're sitting in front of a computer.
And talking.
But I'm using an inflatable lumbar support because after this, I'm going for a nice ski. It's -20 outside. It's fabulous. I'm going for a ski with my dog.
And that's also one of my, sorry to interrupt you, that's also one of my questions about his lumbar supports. because I've noticed that some people, these lumbar supports are they became very popular now. Maybe because of your work. Also, some chair manufacturers, they build into the chair, these huge lumbar curves. And what I've noticed, especially with some herniation patients who used to have the flexion pain mechanism, they kind of start using these lumbar supports everywhere. It was fine for a few months or years even, but then suddenly they developed a huge, very painful extension-based pain. So maybe we could also, because I like this "it depends" philosophy, maybe we could also, you could say some things about, maybe with some of those cases, if you ever used or cued them to use more, a bit more flexion when they sit. Is it suitable when they develop, this extension pain because of the lumbar support?
Well, you know the answer, and the answer is it depends, of course. People, and again, I don't know whether it's social media that is so polarizing on different topics. You're either in one camp or another. Sure. It's never that. It's always about tuning and finding the magic sweet spot between too much and too little. I get patients who they'll go to a McKenzie trained therapist, and the McKenzie trained therapist will say, well, you've got a dynamic disc bulge. Mm-hmm. It's pressing on a nerve root. You're getting sciatica. If you do floppy push-ups, repeated extension, it will reduce the size of the bulge. You know the mechanism, and then it will unleash the nerve and the sciatica goes away. And we've measured that and proven it. It's a bona fide mechanism and it's a bona fide therapy. However, if the therapist says, well, that worked, what you're going to do now is do 20 sloppy push-ups over the next year. Now the patient comes back in a year and they are extension intolerant, as you're pointing out. Extension has now become their new pain. Why? They crossed the biological tipping point. More was not better. Instead of saying, at the time they had a disc bulge, it was an appropriate therapy. But after the bulge resolved, stop. It was no longer an appropriate therapy. Something else was far more appropriate. So it's this misunderstanding, I think, of the mechanisms and how they change as people heal and recover their abilities and that kind of thing. So getting back to the backs, oh, by the way, we've measured this. Simply having the person laying prone on their tummy and quiet, relaxed breathing was every bit as effective at reducing the size of the disc bulge, if it's a dynamic open fissured bulge, as floppy push-ups, without adding any trauma, and that's the right word, repeated trauma to the facet joints and causing that extension.
So no need for hyperextension. No need for hyperextension, right?
Well, particularly if the disc has been flattened a little bit, because now a flattened disc naturally carries more load on the facet joints where it should have been borne by the disc at its normal height. So it's interesting that when a person gets hypertrophied, painful facets, they're at the level of the flattened disc. They're not at the joint above and below, But getting back to the back supports, more is not better. That's why we built them with the pneumatic chamber. So inflatable. The person, inflatable. They're adjustable, not too much and not too little. But people pump them up thinking that is... more is better. Where did the modicum of common sense go?
Yeah, I totally agree. So did you ever give an advice to such an extension-based patient to maybe sit in a slight lumbar lordosis? Does, this kind of tips, if we are in this philosophy, it depends. Can this type of patients, did they occur to you that you told them maybe for you it's better to sit in a slight lumbar lordosis to wind down your pain?
Yeah, I understand the question. When we give them a lumbar support and inflatable, we give them a coaching lesson on how to use it. So let's go one back layer further because it's easier to give this example. Say a person has back pain laying in bed. I'll say, take your hands, it's a test, palms down under your low back. Now push your hands in. Did that take your pain away, or did it cause it to get worse? I don't know what the answer is. They will know. And then I'll say, now tune the amount of support with your hands. Or let's take a towel. We'll fold it once, then we'll fold it twice, then we'll fold it 3 times. And we will converge on the optimum posturing of your spine that takes the pain away. So we do exactly the same thing with the pneumatic support. So there's a guideline, but knowing what the mechanism of their pain is allows us to predict the future a little bit. And we'll say, here's what it is today. We suggest that you bias that in the future as your pain winds down to a little more lordosis or to a little less. And it's so interesting. We did a study. The primary author was Joan Scannell, who did her PhD with me. This was published in Physical Therapy in 2005. I think it was the most downloaded paper of the year, so the editor told me. And what she did was she screened people who were hypolordotic and hyperlordotic. And then because she said to me, she was a McKenzie trained therapist, and someone would come into our laboratory and clinic with a lot of lordosis, and she would say, oh, we should try and get them to perform a pelvic tilt and reduce some of that apparent hyperlordosis. And then the next person would come in with a flat back, and she would say, oh, they're hypolordotic. Yeah, we should give them a bit more lordosis. And I said, wait a second, that's normal. That's the way God made them. And just leave them alone. And she said, no, I think. So I said, all right, let's do the investigation. So what was the metric? The metric was elastic equilibrium. So every joint falls into elastic equilibrium if there's zero force on it. That is the position of least stress. So you find that for the back. And we made jigs to position each person to find out where there was zero stress in their back elastic equilibrium. And it turned out that the flat backs, when we measured where that zero stress point was, and then we asked them to sit down. So they sat with a flat back. They stood with a flat back. And then when they sat down, they flexed their spine, which is normal, but they moved into stress. The hyperlordotic, the ones with a lot of curve in their back, they stood in elastic stress. And when they sat down, they moved into no stress because they added a little bit of flexion. So do you see, once again, it matters. Where is
your
the tipping
point?
Yeah.
Tipping point. Yeah.
And where is your elastic equilibrium position? So like everything, it's a dance with the devil. It's a trade-off. If you start flat-backed, chances are you have less stress in standing, but sitting is going to be more stressful. If you're hyperlordotic, you stand in elastic extension. And okay, sitting down relieved some of your stress. So 2 different people, but just let me finish this idea up. And then the third part of the study was, she said, well, I'm going to change them. I'm going to move them away from their high stress through postural change. And I said, I don't believe physical therapists can do that. So I'm already wrong because, I said, God made them that way. That's not let them. And I know there's memes on the internet saying all these postural deviations are normal. I used to believe that, but I don't believe it anymore after that study. People stand in stress, which is different from the next person who comes in. But then can a therapist change them through corrective exercise? I didn't believe they could. So I'm already wrong once. And she used a Yanda approach, which was for the flat-backed people. She gave them no gluteal exercise. She gave them a little bit more extensor training in the back and opened up their hips a little bit more and freed them. And then for the hyperlordotics, she gave them a little more gluteal exercise and some abdominal exercise, etc., following a very Yanda-like approach. Do you know she changed the average elastic equilibrium point over, I forget what the training period was. Let's say, for example, it was 2 months. So again, I was wrong. Yes, therapists can move people away from the stressful point with postural change. And number two, corrective exercise can help. Now, does it help everybody? Of course not. But when you look at the variance of response, there are some what we call super responders, and there are some people who don't respond at all. On average, the results aren't that impressive, but that's every study. But people don't look at the variance of data anymore. They read the abstracts, and the study says, well, no difference. Well, wait a second. 50% got worse, 50% got better. What was the difference in those two groups? Now you become a clever clinician. So
I like when what you said. God made them this way, because still, I see sometimes, or many times actually, that many therapists try to fix something that is not broken or broken yet. They just assume, someone has no pain, for example, and they're not interested in this, that he has no pain. They just see someone with a flat back or lordotic back, and they say, oh, you need more lordotic back. Even though there's nothing broken with him. I've noticed also that you helped to make a new yoga course, online course of yoga with Yogi Master. So can you tell us a bit, how is this yoga course different than a usual yoga? And what are your contributions and maybe some tips for yogis?
Yes, well, several stories there, but since you mentioned the course, my partner in that was Berniejem Clarkom, who wrote two quite influential books. The first book was called Your Body, Your Yoga, and the second book was more specific, called Your Spine, Your Yoga. And Bernie had attended several of our courses, and he integrated quite a number of the principles for yoga people. So that was the introduction of it. It's so interesting when you look who is in the hip surgeon's office for consults for hip pain and whether or not they're going to get hip replacement. If they are a woman, say, from Western Europe, Holland, France, England, Ireland, that whole gene pool. It's interesting how many of those hip surgeons will say, these are women who've done yoga for 20 years. Now, maybe not in other parts of the world, and there's probably some good reasons for that. But nonetheless, these women have pushed their hips in full flexion, which when you look at the architecture and anatomy of a hip joint, it's a ball and socket with a labrum, a ring of cartilage around it, and and they've torn their labrum, or basically they've crushed it over time, and now they have hip impingement, painful, and to the point where that is now kicked off an arthritic reaction, and they think that hip replacement will be salvaging for them. So now back to the yoga video. We are all advantaged and disadvantaged to do different things. So what gives us an advantage for one activity is a disadvantage for another. That's why there's so many athletes, and a basketball player doesn't look like a weightlifter, and a weightlifter doesn't look like a gymnast, and a gymnast doesn't look like a swimmer. They're all different types of animals, if you want to think of it that way. Mm-hmm. So yoga isn't particularly suitable for all types of people. There are certain asanas that you could choose any one, and you say that person's body type will probably thrive on that particular asana. But you do that to the next person who say it's a very hip flexion type of challenge. If they keep pushing that hard hip flexion over time, they create pain and physical damage to the anterior part of the hip joint, and they kick off if you want to use the word degeneration, you can use that if you like. I call it's just chronic injury. So that asana should have been adjusted for their body type. That's what the book and what Berniejem Clarkom contributed. He gives yoga teachers assessment protocols. So the whole class doesn't do the same asana or the same pose or the same movement. Mm-hmm. He says, this half of the class, you've got sensitized hips. Now, if you do hip flexion and your hip is painful, you avoid hip flexion. Where does the flexion go? Into the back. So now you start to see the chain at work. Those who have hip impingement all of a sudden have a higher incidence of flexion intolerant lumbar spines. So you have to get the movement from somewhere.
Sure.
And if you compromise, but some people do this to themselves with yoga. Now, let's take another athleticism. Let's go back to the idea of jujitsu. Jujitsu is taking a posture and loading it. And if the person doesn't submit because of the extreme pain, the joint will tear. It's so easy. By changing the angle just a little bit, you will avulse a person's joint. You don't have to be strong. Jiu-jitsu practitioners aren't strong. You don't need it. You just need the right angle and the right posture, and you will pull their body apart like that. It's so clever. That's why I love to study it. It's absolutely fabulous.
It's a biomechanics 101, the jiu-jitsu.
It is. So what's the difference between jiu-jitsu and yoga? You see, if you don't match the body type, yoga suddenly became jiu-jitsu. And you can turn jiu-jitsu into yoga as well if you know what you're doing. So it's a very interesting discussion and parallel to make. But the great teachers, and why we did the video, it was to educate them on doing some quick assessments, start to subcategorize the people that you're trying to help, and make sure your yoga does not become jiu-jitsu for some, and it become, and we could say the same thing about Tai Chi or anything else. It's fabulous for some. I mean, I look at myself now, I have zero pain. I'm in my middle 60s. I have zero pain. I feel absolutely fabulous. I do more mobility training now than I ever did before. When I was training heavy in my 20s and 30s and early 40s, I loved it. I had no time for mobility training. But now my body type has changed. My age has changed. My training goals have changed. I just don't want to lose any more function. I want to be pain-free. So I do a little bit of strength training, a lot more mobility and movement training. Absolutely. I want to, if I catch my toe on a piece of ice or a sidewalk and I stumble, I've got to get my foot out in front of me very quickly to arrest the fall, right? It's biomechanics 101. You can't argue with that. I've got to maintain hip power.
Okay, next question that we have.
My wife thinks I should take up ballroom dancing with her. I don't know if I'm going to go that far.
Well, ballroom dancing, what kind of dancing?
Well, it would have to be quick step, foxtrot, and all that sort of stuff.
Oh,
switch. Okay. And salsa. My hips don't work for salsa.
Probably not, You had a hip issues.
Well, no. I just thought I have to hang out more with my Spanish friends and get the nice little swivels.
To get your body in a nice elastic movement ways.
I know. I'm working on it.
But would your spine be suitable for that? Do you have more of a stable type of spine, or do you have more of a bendy type of dancing spine?
Well, it used to be a far more strength spine, but I'm absolutely adapting far more mobility now. However, I can't do the strength.
Yeah. So you noticed the strength went down by getting more mobile.
Oh yeah. Well, it's been natural. But it's been purposeful training as well. Remember, I said my goal now is to not lose function and to stay pain-free. So if I went back to heavy training again, I would be in pain.
Sure. Yeah.
So I'm seeking that. It's biological optimum, and it changes through. If I just think of my own history here, how my life has evolved, and I've had to evolve my body and my training to keep my. To remain as pain-free and robust as is appropriately possible.
Well, since you mentioned strength as well now, I have a question about, you often say that coaches focus too much on strength because it's the easiest attribute to train, to attain, but sometimes they lose elasticity with their clients or their athletes. Could you maybe elaborate more about how to get this elasticity within ordinary clients or also, some athletes? How to train for elastic movement, not this stiff, hard computer type of movement?
Yeah, I gave you an example of the person who comes in who's overly stiff and is crushing their joints. They're not efficient in their movement. They're co-contracting throughout their body. And that's a natural response to pain. You grip into the pain, and not always, but that's quite a common neurological, you go,
sure.
And even after the pain is gone, sometimes those neural engrams remain. So I've already given the example of someone who just teach them how to stand with no muscle activity. And it's so interesting when the person will say, I went to the doc and they gave me muscle relaxants for my muscular backache. And you've just shown me if I just adjust my posture, the pain went away. And I said, well, yeah, for the first time, we just turned your muscles down and taught you to relax, and then coached you how to walk. So there would be an example of a very modest goal in a modest person who just wants to stand and walk with no pain. But when you get to an athlete where they have to throw a javelin, or they have to exert skill in combative athletics, or they have to run fast, think of the nervous kid who used to sit beside you in school and they would bounce their toe up and down like this.
Yeah.
Well, we call that a foot ricochet exercise. Well, in a way, that's a perfect tuning exercise of elasticity. So if you don't have any tone in your foot and leg muscles, you can't do that resonance. The foot just plops to the floor. But if you add a background activation level to the muscles, you've now created what's called series and parallel elasticity in the linkage with the muscles and the tendons. You engage the springs. Now, when you get it right, all of a sudden, you can bounce your toe with very little effort. Now, if you create too much stiffness, it becomes rigid, and you can't bounce a piece of hard steel. So you have to detune that to turn it back into a spring. Well, that's exactly what runners do. They tune the amount of spring so that when their foot hits the ground, it's not completely passive. There's a muscle there that tunes the spring. And then when you measure some great long distance runners, for example, they bounce off springs like a bunny rabbit or like a kangaroo, greatly increasing their efficiency because they don't need concentric, eccentric muscle contraction with every stride. And then you get the next person who, before they warm up, they do ankle stretches. They lean against the wall and they do the runner's Achilles stretch. I can tell you a quick story there. I had quite a successful marathoner who came to me with back pain. And as I usually do, I'll say to the athlete, what athletic gift would really change your performance while we're working on the mechanics to eliminate the cause of your back pain? And he said, well, the first 2 miles of my marathon is terrible. And, the bells go off in your brain. Well, I wonder what your warm-up looks like if you're so unpotentiated that the first 2 miles, and then his whole race strategy was then he has to fight for the remaining 22 miles or whatever it is to catch up and hopefully win at the very end. And I said, well, show me your warm-up. And it was all passive stretching. He was just passively stretching away the springs, and it took 2 miles to restore the neurology of the springs. So I said, don't warm up that way. Do a few pogo jumps, a few bounds and that kind of thing, and then get your hormones and blood pressure up and get a bit of a sweat on to start to run for your marathon. But forget all the stretching. And then he came back to me afterwards. He said, my back pain's gone. He says, and I just had the fastest first 2 miles I've ever had in my history. Thank you very much. So there's an example of tuning springs.
It's a great story. Okay, we've got one question from one of my customers. She's a stenosis patient, and she asked me if we can elaborate more about physiological physiological perspective, how it works when we apply your mechanisms from the book Back Mechanic and we wind down the pain, but how physiologically body responds to that, so the nerve pain gets away, what changes in body physiologically so that we don't have a nerve pain anymore in instance of a stenosis. Or you could also use some different example of maybe some other type of injury. But if you could say some words about that.
Yeah, well, again, it depends. And what's stenosis? Stenosis is, if we just use the Latin root, it means a compromise of, a narrowing of a canal through which a nerve transverses. So what's the cause of the narrowing? Is it a dynamic disc bulge that shrinks and grows because of posture? So if the person sits for 45 minutes, their right toe goes to sleep. That's a form of stenosis. When they stand up and go for a walk, it goes away because the disc bulge slightly decreases now because they're not in that loaded flexion. Maybe the stenosis is from an arthritic, hypertrophied facet joint. 2 or 3 years ago, they lost a bit of height from that level of the disc through an end plate fracture. They lose a bit of disc height. Guess what? It's that facet joint that now bears a lot of load. They're doing perhaps too much extension. That causes the facet joint to thicken. That's the biological response. Now, if that is the mechanism, that's a different answer than the one from the dynamic disc bulge. So stenosis is not a diagnosis. It's simply a description that requires more investigation. So once you've honed in on what the precise pain mechanism is, now you can start to tune the treatment. So if it is truly the exiting foramen for that nerve root, chances are we would probably do some sort of nerve mobilization, like a nerve flossing kind of therapeutic approach. Get the nerve moving, and they have this curious ability to find their own pathway and make their own pathway. Yes. So even though the bones get together, the facet joints get narrower and narrower, the nerve can find its own pain-free path. They seem to be able to reduce the friction on them. So it's interesting. When she reports distal radiating symptoms, and someone has told her it's stenosis, is it a function of nerve stretch, or is it a function of nerve moving and friction? Two entirely different things. So when we create the symptom and then I get her to move her head like this to allow the spinal cord to migrate caudally, did the pain get worse as the nerve moved, or did the pain get worse as a function of static stretch and posture? You see, there's so many nuances of this, but a good clinician will determine if it's friction. That's very different from a final position causing the stenotic radiating symptom. So if it's a friction, once again, we work to find out what is the source of the friction, and if it's a disc bulge, okay, we will direct therapy first at the disc bulge. If it is an arthritic bone, once again, we'll try various postures and then specific nerve flossing movements within the posture that gives them the most movement of the nerve. So we might put them into slight extension or slight flexion. Anyway, you've taken our courses. You know the clinical nuances of this. And if someone thinks they're going to learn it quickly, I'm afraid they're going to be mistaken. To become a clinical master and hyper aware of what is really causing the pain in the person, and then having enough skill in pulling out the most appropriate treatment tool, then Okay, thanks for this physiological elaboration. So I think that's very empowering, so people can hear. Well, I could go on and on with that one. I mean, I'm just thinking if the stenosis is from a micro movement, in other words, the joint is now lax, and when they move to a certain angle, the joint clunks and does that. well, we've measured these clunks and spines. If she was able to, if that was her mechanism, add a bit more stiffness to engineer out the clunk, now the stenosis is gone. Because the stenosis was caused by the clunk and the kink in the neural pathway. So again, I need to know the precise mechanism of what is referred to with this label of stenosis, and we will see if there's a possibility for a very well-matched therapy. So stenosis is a huge topic. As you know, we can spend days on how to diagnose the actual pain mechanism and get a clue on what to do about it.
Okay, thanks for this elaboration. As I said, I think it's very empowering for people to hear that their diagnosis is not a dead end, and body can adapt with proper treatment. Of course, bodies always find a way to get pain-free.
Not only is it important to tell them that, it's so important to demonstrate
to
that.
Show them that.
Show them immediately. That just caused your pain. Now we repeat, but do it this way. It just took their pain away. That's where the psychological empowerment comes from. Showing them and giving them a strategy so they can do it. So that's a little bit of a point of contention that I have with some of the cognitive behavioral therapy approaches that people are promoting right now. You've got to, of course, explain to the person, and we believe in telling them the truth. What is going on from a medical point of view, but we also give them a strategy that they can prove immediately. Wow, I just tied my shoe without pain. No one has ever shown me that before. I get it. My mind is at ease now. I know I'm going to beat this thing. You just proved it to me. That is the psychological, the best cognitive behavioral therapy is when you can empower the person because you just showed them and coached them how to do something pain-free. Absolutely.
That mark these words, people. So we will especially try to tell people exactly the same wisdom. You often see patients from all over the world. How do you manage to coach them and using simple enough cues and instructions in these 3 hours that you have with them? Because they will never see you probably again, or they flew to you from Australia, for one session of 3-hour assessment. How are you able to, in those 3 hours, to give them just enough of information to get them better for forever, so they can help themselves even when they are not with you? How do you do that? Maybe some tips for that.
2 words. What's the answer?
It depends.
Yes, it depends. So some people, believe it or not, when you can give them a strategy within 3 hours and show them here's what you can do to become pain-free, that's it. They're easily coachable, and there you go. I do invite every person who comes to bring, now if they're a famous athlete, they bring their team with them. They bring their strength coach, their psychological relaxation coach. They might bring the team doctor. I had a pro athlete here, and he had 4 different clinicians with him a couple of weeks ago. So, and they all fly in.
Quite an expedition.
Yeah. So, and by the way, that was about a 6-hour session. But part of that is training the people who are responsible for this particular individual. So sometimes it might be a session on one day, and then they sleep over, and we fine tune the whole session the following day. So it isn't always a 3-hour session. So that's one strategy. I do invite the people they live with to come. So bring your spouse, bring your partner, because they get full license to nag you when they see you violating the insults that we just proved was causing you pain and keeping you sensitive. If you change your behavior doing specifically this, you will wind down the symptoms. So that's another strategy. that is important. We follow up with every patient with a 6-week interview, and that's usually done on Skype. And I'll get on them and I'll say, well, how are you doing? And they'll say, you know, I'm fabulous, great. Now, what do I do for the next level or progression? Now, I wrote them out a progression and gave it to them, but we hone that. Now, the patient might say, you know what, I'm worse. I am now worse after seeing you. And I'll say, all right, tell me what's going on a little bit. And then I find out, well, they're on Facebook doing kettlebell swings or something like that. And I said, it isn't a matter of doing the exercises yet. It's a matter of winding down the pain from not doing things. And no, they're an intelligent person and they still couldn't get that through their head. So I'll say, look, humor me for a couple of weeks. Please just do as I say. So that might be the strategy for that person. Someone else might say, you know, no, I'm worse. And I'll say, well, this doesn't make sense. Let's do a few more provocative tests. So I'll be on Skype with them. We do this, that causes pain. I said, that doesn't make sense. Okay, there's something else. And then we get into it a little bit more. And then we find, I say, you know, I know where you live. I know what the risks are. Have you ever been tested for Lyme disease? And they'll say no. And I said, well, the pattern that you're showing me and your unresponsiveness to the physical shows me that there's something that we're missing. So we've picked up a few cases of Lyme disease. They go and get treated, and guess what? That stubborn back pain went away. Or we found cases of aortic aneurysms, lung embolisms, cancerous tumors, really nasty things that this has saved people's lives. Why? Because we didn't give up. There was a reason for their pain. It might be that they're in an abusive relationship. Someone says, you know what, I thank you for giving me the extra. I couldn't do them. I can't get down on the floor and do that in my own house because my husband or my boyfriend or whatever, that would trigger a reaction in them that threatens me, and I can't do that. So if I didn't know that, so do you see how, again, it depends on the context? Yes. And but I can tell you, you know me well enough, Yuri, we don't give up. We don't give up. If someone doesn't get better, damn it, we don't give up. There is a reason, and we're never going to say it's in your head or something like that. There may be a pain magnification, there's no question, but that is still part of the mechanism. We will keep working at it until we get there. Wow,
that's really great story, especially when you mentioned that you were also able to find other causes for back pain like tumors and things like that. It really helps if also trainers would have this, if we would have this knowledge to also not always find, not always seek or be able to find a cause in movement, but also in diseases or conditions like you mentioned, these special cases.
If you can't find a movement or a posture or an activity that changes their back pain, it's not mechanical. Mm-hmm. So that is the red flag right there. Mm-hmm. It's something else.
Something else.
Yeah.
Thanks.
And then it doesn't mean that they don't have a cause. It means you bloody well have to go and chase whatever the something else is.
Sure. And to tell them to get a proper screening for that.
Yeah.
Okay. The last question. What would you say can a McGill method philosophy be applied to other painful parts of the spine or body as successfully to low back? Maybe in the future, someone will adapt these principles to other areas of rehab as well?
Well, not? I think they do. I mean, there's nothing magical about it. The general principles of avoiding a specific pain trigger works for your thumb just as well as it does for your toe or for your neck or your lumbar spine. And then pacing the recovery. It's an art and a science. Why do some coaches, why is it them at the Olympics year after year that they have produced another new crop of gold medal sprinters. I mean, you may know the coach I'm talking about. He has more medalist sprinters than anyone probably in the history of the Olympics. There's a reason for it. He knows how to tune it, and but he's just following the same principles as us. When I do a consult for an Olympic team in some country in Europe, guess what? He was there the week before. So, we follow each other. It's just an example. But, you can't get around. You've got to have proximal stiffness and stability. You'll never win a sprint without it. If you're in pain, the brain will not send full neural drive to that part of your body. If you're a power lifter, if you have an unstable spine, your brain will shut down neural drive. It won't give full strength signal to that area. I mean, these are universal principles. But having said that, I'm not going to discuss other areas of the body just because I'm not the world's expert. I'm quite happy to stay within my little area there and understand how the hips affect the spine, how the knees and the feet understand the spine. I get all that through the linkage, of course. Yeah. But don't come to me with primary shoulder or neck pain. I'm going to send you to another expert for sure. So I guess that's how I would answer that. These are universalisms.
Yeah, I think every one of us should find our forte and stick to that, and be not to be afraid. People or professionals sometimes are afraid to tell the client, "I can't fix you. Look, I have a friend here who deals with these problems, and he can help you." And it's
I have my phone here with my Rolodex on it, as I call it, of all of my professional colleagues. So if someone comes in with me and they have a little bit of a muscle tear in one of their erectors, I'll say, well, we'll take the load off for a while, see how you respond. If they respond, great. If they don't, I know who I'm going to send them to because I don't have that expertise. But the right biologic with PRP and some interleukins and some really clever
manual therapists as well.
Sure, of course, there are some people who have absolutely magical hands, and it breaks my heart a little bit when I hear these just absolute statements. Oh, manual therapy is no good. Wait a second. I send some people who I do the best job I can on their backs, but they might have a little niggly snag in quadratus lumborum. I don't have manual skills, but I send them to the guru who I know who does have them. 3 treatments, and they go and win a gold medal at the Olympics. And then they come back in the Winter Olympics in a different sport, and they do it again. So, when
manual therapy, it exists for millennia, right? So it must be something workable.
I have a heavy Rolodex of all of my gurus around the world. And if I don't know, it's a different world to live in for sure. But to create a gold medalist, what you're doing is creating a human F1 race car. And if you have a 2% flaw in one aspect, you don't win the gold. You come 7th place. So it's quite a game, and it's an education to bring together and really appreciate what all of I call it the brotherhood and the sisterhood, people who really know their stuff. And by the way, they're not on Facebook. They don't have time. They're doing the mastery of their craft. But it's funny what you see on social media sometimes that, manual therapy doesn't work.
Exercise doesn't work.
Exercise doesn't work. Oh, it's okay to have poor posture, or your spine isn't fragile. Are you kidding me? You get the guy who's now competing for CrossFit. And they're very, very good. They're competitive, and they've got a real chance. And you tell, your spine is robust. Just keep training. No, That's why they are so overtrained all the time.
That's true.
Your spine is not robust. You've got to detune it a little while and allow it to gain its robustness again. But the next person, they're a lazy sloth, and you got to tell them, your spine is not robust. Get going. So it's all context. There's never an absolute statement, and it always needs this context. But anyway,
it's really interesting what you mentioned. Yeah, it's really interesting what you mentioned. Yeah. You can't say, your spine is not fragile, go on to a beast like this, while on the other hand, to a lazy sloth, you can say sometimes, come on, your spine is not so fragile to sit on a couch all the day, go and train a bit.
You should say lazy slob, not lazy slut.
Yeah, that's true. That's true. For the respect of Australia, eh? No lazy sloths. Yeah. My bad. Okay, Stuart, really nice conversation with you. Maybe you could tell a bit for what are your plans for the future now, since you've been professor for all of those decades. You've been teaching at the seminars, the workshops, screening and teaching your clients all the time. Any new ideas, how to spread your work around the world?
I know I have ideas every day. And
you told me that hamster is always working.
The hamster is always on the wheel. And I get so many, particularly business people who want to, commercialize somehow better what we do. And why? Because they're going to make money on it. And sometimes the ideas are kind of interesting and whatnot, but at my core, they don't interest me. To me, it's not about that. So I will continue to see very challenging people who are suffering. I continue to see the fabulous athletes because that is such a laboratory and clinic to work in and see what is humanly possible, because it helps us all to be so much better with, the average people, the real people who are struggling with pain. But I'm slowly backing off the courses that we do, and I will be using the internet to put on some courses, and then I will have my fabulous teaching colleagues to put on the physical hands-on skills development of doing assessments and creating therapeutic exercise and actually understanding the dose response that you're creating in that particular person. So that's the future, and there's several reasons for that. I don't have the energy I used to have as a young man, and B, it's harder to justify the wear on the planet of flying to places and all the rest of it. So the less we can do of all of this is something that I think a lot about.
So more online teaching as well, more online courses. Mm-hmm.
Yeah.
Okay. And you see more athletes recently, or more of a
No. I wouldn't say more because they've always been there. But I mean, you know the number of requests I get, and I simply can't keep up. So I do train some what we call master clinicians as well around the world, and that takes me time. But they come in, and you've been to. You have not been to BackFit Pro here, have you?
Not to the headquarters. Not in Canada. I said to myself, I'll be in Canada when there'll be time for that. I'm sure. Yeah. I'm for sure we'll be there. But I'm not gonna go there just. I'm gonna go there for a reason.
Yeah, so we have a place to house them. So when we're working with patients, they participate and continue their mastery path.
I will have a visit of your headquarters for sure. So in the future.
But the rest of the time, I'm out in the woods at my cabin chopping firewood.
I'll help you with that. I like chopping firewood. Just recently, I've been chopping firewoods at my girlfriend's house in Ukraine, and it's such a relaxing and good thing, to be in nature and just to work a bit.
Yeah, no, I have a great affinity to the northern part of Russia and Poland and their training philosophies and the way of life. Yeah,
the way of life as well.
Yeah, very much the way of life. Maybe I was born
Polish or Ukrainian.
Well, I think a lot of it would have. And as you know, we have a huge population of Poles and Ukrainians in Canada.
And your best friend from childhood is Ukrainian, right?
You remember that? Yeah,
I remember everything.
Yeah, but no, that's one great thing of Canada is your appreciation for. The cultures and how they all come together, and everybody has something really interesting to contribute.
Spicy, yeah.
Nice,
okay, nice mixture of people. That's true.
Yeah.
Okay, Stuart. I ain't gonna be bothering you anymore. I hope we had I was enjoying this conversation. So
yeah, myself included.
I had a great time, and we'll do it in person. I promise you that in the near future. If you'll be in Europe or I'll be in Canada, so you will have a McGill courses in Europe this year, right? In Netherlands.
No. It's going to be in 2021.
Oh, 21.
Yeah, okay. I can't fly across oceans.
I know. It's.
I'm in Australia next week. And
that's a long one.
That'll wipe me out for a few months. It's not healthy for my body anymore.
Yeah.
And I'll come to Europe once next year.
Okay. So, really, thanks for taking time for us.
And thanks for all you do, and thanks for doing these things and helping getting the message out. And I will say this: I know you have worked personally with my wife and my daughter and setting up some of their training programs because they don't listen to me. My wife says, "Why would anyone listen to you?" And
any wife.
Yeah, and I know you've done fabulous work with them. So thanks for your continual effort to improve your mastery.
Thank you, Stuart. To everyone else, have a nice time and think and listen to our conversation and to the words of wisdom by Stuart McGill.